Hey there, and welcome. If bedwetting is a source of stress and worry in your family, you're in the right place. It's a journey, for sure, but you absolutely don't have to figure it out alone. In this explainer, we're going to break down the guidance from the Dutch General Practitioner Standard to really get a handle on bedwetting and give you some clear, practical steps you can start using right away.
So here's our game plan for today. We're going to start with the basics, what bedwetting actually is. Then we'll dig into why it happens and walk through a step-by-step plan from simple support all the way to the most effective training methods out there.
If that question hits home, I really want you to hear this. You are so not alone. The frustration, the endless laundry, the worry, it's a lot. It's a heavy load for everyone involved, especially the child. But understanding the problem is truly the first step toward solving it.
All right, first things first, let's all get on the same page. To find the right solution, we have to be crystal clear about what bedwetting is, and just as importantly, what it isn't.
Okay, this is super important. We are talking specifically about kids who are 5 years old or older and only have accidents while they're asleep. If there are also accidents during the day, that's a whole different conversation. The medical term monosymptomatic enuresis nocturna is a total mouthful, so yeah, we're just going to stick with bedwetting.
Now take a good look at these numbers, because this should feel like a huge weight off your shoulders. For kids between 4 and 7, about 1 in 10 deals with this. It is incredibly common. But look at how steeply that number drops as they get older. This chart is basically proof that for most kids, this is just a phase, a developmental speed bump they will get over.
Okay, this part is a real game changer. I'm serious. Because once you understand the why behind bedwetting, your whole approach can shift from frustration to, okay, I get it, we can work on this.
I bet this sounds familiar, right? It's probably the #1 thing parents say. And it makes sense. They're so sound asleep, it seems like they just don't feel it. But you know what? The research tells a totally different story.
And here it is. This is the core issue. It is not a sleep problem. It's a communication problem. Think of it like a missed phone call. The bladder is calling the brain saying, hey, I'm full, time to get up. But the brain's ringer is still on silent. It's just a developmental delay, not some kind of flaw.
So what are the real culprits here? Let's break it down. Top left, we've got that main issue, that delayed wake-up signal we just talked about. But check out the top right. Genetics are a huge factor. If one parent dealt with this, their child has a 43% chance. If both did, that number jumps to a whopping 77%. And yeah, sometimes big life stress or even something like sleep apnea can be a factor too.
Okay, so now that we know for sure that it is not the child's fault, our whole approach can change. Let's dive into the first and, honestly, the most important step of all, building a strong foundation of positive support.
Think of this as your playbook, the golden rules. And rule number 1 is to get rid of any punishment or shame. They are not doing it on purpose. Instead, you're going to become their biggest cheerleader. Praise those dry mornings like they just won the lottery. And please, don't restrict their evening drinks. That often does more harm than good. Having them help change the sheets isn't a punishment. It's just part of the routine, a simple responsibility.
All right, so you've built that positive foundation, but you're still looking for more progress. It might be time to level up to some more structured behavioral training. These are active ways to help train that brain-bladder connection.
So here are your main options, from something simple like a sticker chart to the heavy hitter, the bedwetting alarm. Now, the alarm is considered the most effective because it directly trains the brain. But listen, no matter which method you choose, it will only work if 2 things are in place: a motivated child and a consistent family. You really have to commit to at least 2 months to see if a method is truly working.
So how does this alarm actually do its thing? Well, it's pretty brilliant, really. It's a conditioning tool. The little sensor detects the very first drop of moisture and immediately sounds the alarm. This startles the child awake. Then, over weeks and months of doing this over and over, the brain starts to make a new connection. It learns to recognize that I'm full feeling all on its own and wakes the child up before the alarm even has a chance to go off. It's literally brain training.
Now for the question that's probably on a lot of your minds. Is there a pill for this? Can't we just find a quick fix? Let's take a look at what the official medical guidelines say about that.
It's such a tempting idea, isn't it? Especially when you're exhausted from all the laundry and sleepless nights. But the answer? Well, it's just not as simple as we'd all like it to be.
The best way to think about medication is like putting a bandage on the problem. It covers up the symptom for a little while, sure, but it doesn't do anything to heal the root cause. It doesn't teach the brain to wake up.
And that's why, pretty much as soon as you stop the medication, the problem comes right back.
The main medication used is called desmopressin, but you have to be so careful with it. It's not for everyday use. It's really just for short-term, special occasions like a sleepover or a weekend at camp. It works by telling the kidneys to make less pee at night. And because of that, there's a critical safety rule. You must limit your child's drinks before and after taking it. That's not a suggestion. It's non-negotiable for their safety.
Look, if you take only one thing away from this entire explainer, please let it be this. Your most powerful tools are patience, positivity, and truly understanding that your child is not doing this on purpose. That changes everything.
So I'll leave you with this to think about. What's one small, positive thing you can do tonight? Maybe it's deciding to finally start that sticker chart. Maybe it's just having a quiet talk to let them know you're on their team. Or maybe it's just committing to respond with a hug instead of a sigh. Every journey starts with a single step. Thanks so much for being here.